Now let's go.
Welcome on board. My name is Patricia Duku, your usual Bliss Health reporter every day. So today on our panel discussions, I want us to talk about something known as hormonal imbalance. You remember, it's something that has been less discussed in our society, and the effect it has had on almost every individual of our society creates an alarm to make this a public discussion.
Now let's go.
Hormonal imbalance is quite a diverse discussion, but for today, let's base this discussion only on the growth hormones in our bodies. It should be brought to attention that hormonal imbalance affects all the members of the society, that is the men, the women, and the children, and the characteristics that come along with having hormonal imbalances differ from women to men and those of children. Hormones are body secretions that helps in the running of the body's activity, and a patient is described as to be having hormonal imbalance when there is too much secretion of these hormones or too little secretion of these hormones, as Dr. Paul explains.
Women have 4 basic stages where we expect natural hormonal imbalances. Yes, you're talking about hormonal imbalance. The thought goes to women or the menstrual hormonal imbalances, but to your surprise, hormonal imbalance is something that cuts across. It's a condition that cuts across all genders and all ages. Hormones are basically chemical messengers or chemicals within our system, which are basically coordinating a number of functions within the body. Broadly to put, they coordinate a number of metabolic processes as well as certain reproductive processes. So metabolism and reproduction are majorly human functions that are coordinated by hormones. So at any given time, if we have too little or too much of any of the chemicals that we referring to as hormones here, there is likely to be what we now calling an imbalance. The symptoms, there are those that are non-specific, and that's the reason why they can ultimately not be used or be figured out as those that may signify hormonal imbalance alone. Symptoms such as anxiety, irritability, or nervousness. Symptoms like general fatigue. There are those that are more specific, like menorrhagia or heavy bleeding during menstrual cycles. That is very specific to women. We have lack of periods, also very specific to women, or what we call refer to as amenorrhea. We have some other specifics in women, like vaginal dryness. We have others like painful intercourse. Those that are specific to men, like what we refer to as gynecomastia. We have that is basically the overgrowth of breast muscles, whereby you find a man with protruded breast, which is not supposed to be the case. We also have ED, or what we refer to as erectile dysfunction, in some men with hormonal imbalances. In children of puberty of that particular age are likely to especially girls, are likely to exhibit low growth rate. They are likely to exhibit late menstruation or the late start of their menses. They are also likely to exhibit lack of breast growth. Women majorly are affected by the menstrual hormones. The imbalances occur in the menstrual hormones. So one of the main causes of this imbalance are hormonal therapy. And hormonal therapy, they do it using medications such as the birth control pills. Stress is also coming out as one of the major aspects that can easily be able to tamper with your hormonal supply within the body. Now, having mentioned stress, it is important to note that women majorly with the menstrual hormones But it is also important to note that when we talk of hormonal imbalance, some of the most common affected hormones within the body, one is hormone that we refer to as cortisol, and the other one is insulin. Cortisol is also referred to as a stress hormone, while insulin is referred to as the blood sugar hormone. Now, cortisol, why is it referred to as a stress hormone? Because it's what controls, it's one of the hormones that is supplied or secreted and supplied within the body, and it's the one that controls how we behave in terms of our moods and all that. So at any given time that you are stressed, there is likelihood that its production is really not going to be normal, or the level of production might be either too much or too little, depending on whatever is bringing about the stress. So you realize that when that happens, there is likelihood to be a devastating effect on some of the very important glands. One within the brains, and one of the most important glands within the brains that is primary in production of majority of the hormones is what we refer to as the pituitary gland. One might experience standard growth, one might experience gigantism or excessive growth if it is produced in excess, and so on and so forth. Another aspect that can also lead to menstrual hormone imbalances are basically the diet as well, and it plays a very big role. Women have 4 basic stages where we expect natural hormonal imbalances. During puberty, normally the body now transists. The body of a lady transists from that childhood to now the puberty stage, where you expect that you need to start having your menses, okay? Therefore, follicle stimulating hormone production from the anterior pituitary gland will actually, stimulated by hypothalamus, will actually be done. The production of the activation of the ovaries should actually be done, and therefore you will expect some of these hormones to begin being produced in more or larger quantities than it was. So at puberty we expect natural imbalances or natural changes to occur. Another stage that we also expect a change in hormonal situation within the body of a woman is when the woman is pregnant. So pregnancy is the second one. The third one is when these individuals are approaching menopause. First case is when the woman is lactating.
Hormonal imbalance is treatable, but the treatment methods keep differing from one person to the other. This is because different hormones cause different reactions to the body. And again, hormonal imbalances can either be caused by too much secretion of hormones, or too little secretion of hormones, or no secretion at all. Hence, the treatment approaches keep differing according to the organ affected and the type of hormone that is in question.
Remedy to hormonal imbalance actually varies from one particular case to the other. It's majorly of concern to the cause. It's much more tied to the cause, depending on whatever caused the hormonal imbalance. For instance, as I told you, away from the menstrual hormone imbalances, we have other hormonal imbalances, and the most common ones, as I said, we have the cortisol, which is also referred to as the stress hormone, and we also have insulin, which is also referred to as the sugar or blood sugar hormone. When we identify the cause, and then we deal with the cause. For instance, if it's a result of stress, now we'll encourage people to regularly exercise, eat healthy, looking at your diet, regular exercising, having enough or good sleep, because sleep pattern also plays a very big role. If you do not give your body enough rest, what do you expect in the long run? You'll expect imbalances in metabolism, and once that is affected, then automatically it's the hormones that are going to really bring about that particular mess. Okay, now back into the menstrual hormones. Whenever there is an imbalance, okay, we'll always look at the cause as well. If it is as a result of the birth control pills, then the first thing to do is to be able to withdraw the birth control pills. Once they have been withdrawn, normally a grace period is given to see if the body can naturally be able to get back to the track. If it doesn't get back to the track naturally, then there are medications that can be used in order to bring back the body to normalcy. But first, it is always recommended that tests are done. Okay, tests will always be called for before medication, before any medication is administered. You'll always be asked maybe to do some endocrinology tests or hormonal tests, specifically depending on whatever symptoms that you're portraying. They'll always ask you to go and do quantify, so that we quantify the levels of certain hormones, so that when you are given medication, it be specific to whatever is the problem. And normally, you know, it can be a two-way, especially with menstrual cycles. It can either be a problem with the ovary or a problem with the prey. In very rare occasions do we go for medications, and medications are only arrived at after a proper diagnosis, sample taken to the lab, blood sample taken to the lab, and proper quantification done, and a series of them. It normally involves a series of them, but in general, the natural remedies work better. They work better. It's only when it fails that we now resort for the medication aspect.
Thank you so much for sourcing out the wisdom from us. I have been your host, Patricia Bukwen. Until next time to us meet, have an awesome week.
Now let's go.